basically say that biomedical science is a good option or a good plan B when it comes to medicine. The other thing about biomedical science is a lot of medical schools now are looking at their intake and thinking we want people who've got life skills. So a lot of people who go into medicine have already got biomedical science degrees, so you can use a biomedical science degree to actually springboard yourself into medicine, and you would miss the first year. So if you don't get into medicine the first time, sometimes doing biomedical science degree, you can probably have a second chance, and it's only 2 more years in a way, isn't it? 'Cause it's a 3-year course. So you're probably thinking, who is that guy? Who's that? Right, so a little bit about myself, and the reason I want to talk about slightly myself is that I want to get across to you that being a biomedical scientist or working in pathology, you don't have to just work in labs. So many years ago I started off, that's an old warship, HMS Illustrious. Then I worked in London. Then I actually went into the desert in the Rubra Al Khali in Saudi Arabia and set up a lab. Then I went to Kathmandu and set another lab up in the Himalayas, which was really good. Then off to this is Muscat, which is in Oman, and then you probably recognise this picture at the bottom. Ended up in all these exotic places, and I end up in Hull. So the NHS is apparently the 5th largest employer in the world. 1.7 million people actually work in the NHS. Just below McDonald's, weirdly enough. I always think that's quite funny that more people work in McDonald's than they do in the NHS. So there are 350 different careers in the NHS. A lot of people just think of doctors and nurses when you think of the NHS, just doctors and nurses. But I'm here to actually sell healthcare sciences careers. So healthcare sciences is basically it's only 55,000 healthcare scientists in the UK. They're only 5% of the workforce, but last year they did over 1 billion tests and examinations. So you see how important these groups are. We will talk a bit more about the groups. And 80% of all patient diagnoses are done via lab tests. So doctors nowadays rely on healthcare scientists actually for 80% of the time to diagnose and to treat patients. So the healthcare scientists, basically, as I said, there are 55,000, and they're in about 51 different disciplines in 3 broad divisions. So I'm really going to be talking about down that side, life sciences, which generally relate to pathology and medicine. There's another group here, physiological sciences. There is a booklet there which I've given to Vicky, and there's a link to a website at the end of this presentation which you can write down, and then you can have a look at all these different interesting jobs. I always think this one, sleep physiology, sounds quite a good job. And then this one, you've got the physical sciences, engineering, the things, X-rays, nuclear medicine, those types of things. But I'm just going to talk about the left-hand side. So what is pathology? Pathology simply is pathology, which means the study of disease. Simple as that. A lot of people think when we tell them you work in pathology, they think CSI, they think silent witness, they think you're just kind of chopping bodies up or looking at dead things and stuff. But pathology is a very broad discipline, and you'll see in a few minutes how broad it actually is. So as I said to you before, interesting fact, 80% of all healthcare decisions affecting diagnosis of treatment involve pathology investigation. So you can see how important it is. There are only 22,000 BMSs in the whole of the UK. So if you work out 22,000 BMSs are responsible for 80% of all diagnoses, which is only 2.5% of the NHS workforce. So clinical laboratories, what are they? Generally, clinical labs are divided up into 4 bits. There's blood sciences, microbiology, histopathology, and now the emerging techniques of genetics. We're going to talk about all of these different disciplines now. So, blood sciences is made up of hematology, blood transfusion, coagulation, biochemistry, immunology. I know these are all kind of just words for you at the moment, but we're going to go into a talk about these more in a few minutes. Cellular pathology, which is histopath, cytology, infection, which is microbiology, virology, and then we've got genetics. So if we start at the top with blood sciences, so hematology. Now this is where I ask you, what do you think these are? Red blood cells, yeah. And why do you think they're red blood cells? Because they're donut shaped. Yeah. And the reason why red blood cells are donut shaped is evolution or whatever has decided that that is the greatest surface area you can actually produce for a cell. So this is why, because obviously they need to bind with oxygen. So hematology looks at blood formation, looks at cells, and basically white cells, red cells. Anybody have an idea? So these are stained, obviously. These are red cells, and then when you stain them, they appear purple. So these are obviously the donut shaped. Anybody have an idea what they may be? So let's go on this side first. If these are red cells, what are these? They're white cells, yeah. The other day I was talking to some 6-year-olds, showing them some white blood cells, and this little girl put her hand up and says, "Why are they called white cells when they're purple?" Yeah, that's because they're stained, actually. So yes, this is a leukemia, actually. Normally in a blood film you'd only get 1 or 2 white cells, and white cells are there obviously to fight infection, but this is a leukemic picture here. This actually is malaria. This is a malaria parasite, which actually sit inside the red cells. So hematology is all about looking at red cells, which you can diagnose anemia, but also looking at the white cells and the red cells also. Within the red cells, obviously you've got too many, you're going to have a lymphoma or a leukemia, and too few, you're going to become immunosuppressed. So it's very, very important to actually have the right number. So in the laboratory, a lot of these things are automated, but what happens is when they're automated, if any kind of parameters are abnormal, then the scientists will actually have a look at the blood films. And nowadays all the blood films are digitalized, so what happens is that the analyzer will make the blood film and then send that film across onto somebody's PC. So going to part of blood science is coagulation, and really we're just looking at the clotting function of the individual. And as you probably know, that obviously if you cut yourself, there's a whole cascade which actually stops you from bleeding. So we're looking at the clotting factors, and most of these are proteins produced in your liver. And the most common, obviously, clotting disorder is haemophilia, which is, anybody know what factor haemophilia is missing? Factor 8, yeah? Anybody know what factor 9 is called? Christmas disease. They're always good to remember. So the other thing that we do with the coagulation is quite often, particularly as you age, a lot of patients are on what we call blood thinning drugs, warfarin in particular, and warfarin at high levels is very toxic, so you need to make sure that you need to monitor these patients to make sure, number one is they don't form small blood clots, because if you form small blood clots, then obviously they can cause damage not only in your heart but kidneys, and particularly in your brain, because it might cause a stroke. And obviously too little of the warfarin will cause, won't be effective. So blood transfusion is another part of blood sciences. So how many blood group systems are there? Have a guess. But how many major blood groups are there? 4. Okay, so move on a bit. 8 for the rhesus factors, yeah. There's 36 actually. Yeah. I looked that up this morning actually, tell you the truth. Yeah, so there's 36. So there's 2 reasons why you may need blood. First of all, you've had major trauma, and the hospital we work at now has just built its new helipad, so that's in operation now. And if you go for a major operation, something like a bypass, or a heart bypass, or whatever, then you obviously would need to cross-match some blood to make sure that if you did bleed, blood would be available. And obviously it's very important to make sure that the blood is compatible. We all know that obviously if you're O positive, then you can give your blood to anybody, but the problem is that a lot of the problems occurs particularly if you've been given blood before, or you may have given childbirth. You produce antibodies, and those antibodies will break down any other foreign blood that you're given. So it's not just a case of actually I'm O, I'm going to have O blood, I'm A, I'm going to have A blood. You need to make sure that if you're going to be transfused, that you don't have any nasty antibodies which is going to break down that blood cell. If you have a transfusion reaction and it's not stopped within a couple of minutes, then you will die very quickly. What happens is that all of your red blood cells just burst open. So biochemistry, in the other disciplines, well, particularly in hematology, we were looking at the cells, the red cells, or the white cells. In biochemistry, we're looking at the clear fluid all the cells wander around in. And in that fluid, there's just an enormous amount of analytes we can actually measure now. So we can monitor diseases such as diabetes, kidney disease, liver disease, cardiac failure. We can now measure, it's called a troponin, and these are very, very small proteins that sit on the outside of your heart tissue, your heart muscle. And any trauma, these actually get detached and then go into circulation. Then we can measure those, and we can basically, once upon a time, if you thought you had a heart attack or an MI, people would kind of guess. They might put you on an ECG and look at the traces, but generally they're not very good. But now we can 100% say that you've had an MI by measuring these proteins that come off, which really is very, very useful, because then you can triage people. If you've had an MI, you go straight off to Castle Hill these days. If you haven't, then you can go home. And if you're somewhere in the middle, you can be kept in for a couple of extra hours. Strangely enough, presenting MIs or cardiac disease present very, very similar to indigestion, strangely enough. It's very, very similar. So a lot of patients actually go into A&E, particularly at Christmas time, because they eat too much. They actually present with exactly the same symptoms as eating too much, which is, but now we've got these very specific proteins we can actually measure, so we can identify that you've actually had cardiac damage. The other thing we can do is now we can measure, obviously we've always been able to measure hormones, particularly hormones for things like infertility, those types of things, but also interesting now we can measure tumour markers. And certain tumours now produce certain proteins. So for example, if we talk about a pancreatic tumour, they will produce a specific protein to the pancreatic tumour. So we don't actually use them as for diagnosis at the moment, because we use other techniques which we'll probably come on to, but we can use them for monitoring patients. So for example, your tumour marker, if you're diagnosed with a particular, say, a pancreatic tumour, your tumour marker's there. After radiotherapy, chemotherapy, hopefully your tumour marker will come down. But if we're monitoring them every week and it starts to go up, then it's a good way of actually altering the dosage of chemotherapy or radiotherapy. So it's an incredibly useful technique to actually and it's the use of these tumour markers has actually contributed to the cancer survival rates coming down quite substantially. And the other thing that we do quite a lot in Hull actually, we do therapeutic drugs, but also we measure lots of drugs of abuse. We only measure drugs of abuse on urine, and that is because drugs of abuse in your system, they wander around in lots of different forms, but generally they're just excreted in a couple of forms. We haven't quite got onto measuring drugs in hair yet, but I am told that we're going to be thinking about the fact is that if you've partaken in certain drugs of abuse, then actually very small amounts actually get laid down in your hair. So for years later, well, not years later, but kind of months later, depending how long your hair is, you can actually measure the drugs of abuse actually in your hair. Interesting fact. So the last bit of blood science is immunology. Immunology really is about kind of measuring all different types of proteins, looking at the body's immune system. Big thing in Hull at the moment, well, not only in Hull but everywhere, is allergies. A lot of people seem to have developed allergies to all sorts of things. So, for example, if you have an allergy to a cat, strange enough, you actually produce an anti-cat antibody. So we can actually measure that you're actually carrying that antibody. And of course, if you've got an anti-cat antibody, then when you come in contact with a cat, then that causes this allergic reaction. We can measure up to about 600, 700 different types of allergens at the moment. So what we would do, we just do a panel, then just work it down and tell you exactly what you're allergic to. Obviously, there's some very, very serious allergy problems, particularly with peanuts. But with immunology, we can also kind of follow tissue grafts and organ transplants as well. So the second discipline within pathology, obviously we just talked about blood sciences, is cellular pathology, and histopathology is really all about looking at cells, the cellular level. So we basically, two types. It's either if you have a tumour or a biopsy and it's taken out of a live individual, or in some cases after post-mortem to discover basically why somebody has died. So what we do is we make very, very small slices of the tissue, and then we can stain them, and then we can look at them under microscopes, and then we can look at the cell architecture. These cells are kind of hexagonal. So any idea what cells they may be? Hexagonal cells. Classic liver cells are always hexagonal. So we can have a look at this, and we can have a look to see if it's actually diseased. There's a bit missing there, which is a bit fatty liver there. So that person's probably been on the booze a bit. But simply by, obviously, after a lot of training, simply by looking at the cell architecture, it's quite easy to actually identify disease processes, tumours, and various other things. Because what happens in generally cancers is that most of the cells are not properly formed. They're immature cells, so they're quite easy to identify. Right, another question is, any idea what you think that cell that might be? There's a hole in the middle. Any ideas, anybody?
Kidney.
Could be, actually, yeah, could be a kidney. But this case, it's a gut. So obviously your food would come through that way. And this is just basically a little picture of kind of what we would do, make the slides and then stain them. So the other part of cell pathology is cytology. Really, it's mostly gynae or non-gynae. This is sputum, and obviously we know the importance of obviously screening for cervical cancer, and it's very easy. These are cervical cells. I'm not a cervical screener, cytology screener, so I can't tell you, but I think these red ones are abnormal ones. So yes, it's obviously very important to make sure that people are screened, because as in most cancers, the quicker you pick them up, the earlier you pick them up, the more likely you are to survive. This is why men are very bad, but their survival rates are much worse than women, because blokes generally won't go to their GPs with problems until it's kind of manifest itself. Particularly so-called embarrassing, not really embarrassing cancers, but prostatic or bowel cancer. People generally don't go and report them to their GPs until they're quite a long way down the path. So infection. So microbiology basically is identifying any bacteria, fungus, parasite which cause infection. So what we do, so for example, in wound management, so if you've got an infection, not only in wounds but all sorts of different places in a way. So what we do is we swab that infected area, and then what we do now is we grow it on an agar plate, and then we can identify the bacteria. Now we're moving on from agar plates, and what we're doing now is to actually we're going straight to measure the DNA. So we only need to grow it very, very quickly. maybe a couple of hours, particularly if we've got septicemia, and then we can put that specimen through a tandem mass spectrometer, and we can then identify the molecular structure, and then compare that to a library, and we can tell you exactly what infection you've got straight away. The only issue with that one is that once we've identified the bacteria, we will actually grow it again and put it against different antibiotics, because lots of antibiotics are now resistant. Right, what do you think this is in the middle? Give you a clue. It's got a nice fringe. It looks like a fringe, but it's not a fringe. It's something. They're suckers. Tapeworm. Yeah, that's a tapeworm. Not as common as you in whole tropical diseases, but they're a major cause of gastro problems. And these? Yeah, so we've got bacteria, tapeworm. These are fungi. Actually, this is athlete's foot. So these are spores. So kind of, yeah, so this is the reason why you really need to be drying your toes when you come out of showers, because getting these aren't particularly good. So we're looking at, what I say, so infection microbiology, we're kind of diagnosing all different types of not only kind of wound infections, but sexually transmitted diseases in particular. Here's a question for you. What group has the most prevalent sexual diseases? What kind of age group?
16.
I knew you were going to say that.
16 to 18.
65 and above.
Yep, you're right. Yeah, I know everybody goes, ooh, yeah, 65 and above. They are the, yeah.
Why? What are we doing?
I think maybe you should ask somebody else what they're doing. Yeah.
That's another talk.
Yeah. Yes. That is an interesting fact, actually. So not only that, we're also sexually transmitted is quite a. So you've got urinary infections as well, and also gastro infections. We can identify what bacteria is causing that infection. The most important one, obviously, is septicemia. You probably read about sepsis in the press. It's kind of big kind of thing at the moment. Is that if you get bacteria in your circulation, then it really needs to be identified very quickly and treated very quickly. Otherwise, you're either going to lose some of your limbs or you're going to die. So the other part of infection is virology. Once upon a time, the only way we could measure viruses is measuring the antibodies against the virus. So, for example, if we thought you'd had hepatitis B, we would only measure the anti-hepatitis antibody. But nowadays, with our wonderful techniques that we've got, our PCR techniques, we can actually measure the RNA of the viruses, so we can pinpoint the viruses very, very quickly. And all those viruses, measles, chickenpox, hepatitis, HIV. That's important about vaccinations, obviously, because some of these diseases can be pretty nasty, particularly when you're a teenager. Yeah, so screening for hepatitis, HIV, hepatitis A, B. A lot of these are done for pregnant women to make, obviously, because viruses are quite small particles, so they can go across the placenta and infect the child. So just interesting, all these actually new techniques and how we can measure these things. Right, genetics. Okay, now genetics. Genomics. Genetics is one gene. Genomics is the whole gene pattern. Now we can identify the whole of the our genome has been mapped. And what's been happening in the last couple of years is that they try to find a large number of people with particular diseases. So, for example, a leukemia, they're looking for genes. All the people that have got a particular leukemia, they're looking for common genes. So you can actually now almost kind of diagnose a disease by looking at your genes. So particularly things like cystic fibrosis are very that's been going for a while. Now tell me, so in the future you'll have your genetic pattern mapped when you're a child. Okay, Would you like to know if you're susceptible to any disease processes?
Yes.
You would. Why?
Because then you can try and treat it earlier.
Do you not think you would just worry yourself to death?
No.
Yeah.
No,
Right,
because
it's
if
interesting.
something that you could treat them,
Yeah.
you might as well get treated.
So somebody looked at your genetic thing and said you may be prone to some sort of cancer when you're 40 or 50. Yeah, I mean, I agree with you. You can actually put a monitoring process in and monitor people more closely if you're kind of more susceptible to that disease. But there's lots of moral questions around that, isn't there? Can you imagine if insurance companies got hold of your genetic map? You would never get a mortgage, would you? Not that you're probably thinking about mortgages at your ages, but yeah. So genetics is really, really taking off, and I would say, obviously you all want to do medicine, but have a look at genetics. There's a really good genetics website, genetics education dot something or other, but just put genetics education, and on that website there's lots of bite-sized courses, just an hour or 2 hours, and they're all free, and it tells you really about the basis of genetics. This will be the future. We will be diagnosing through our own genes in the future.
So do you think then, Chris, there'll be an opportunity where if I want another baby, I can almost take the genes out of all the brown eyes, the genes out of boys, so I can definitely guarantee that you'd have a blonde-haired baby girl with blue
Yes.
eyes?
Well, there's problems about that. Obviously, there's ethical problems about that. Yeah, but the human genome has been mapped now, and every single gene, you know what it carries or what it is responsible for. So in effect, you could have a designer baby, yes.
But what's happening with it? Loads of other complications.
I don't know. In fact, you could have a baby with more than 2 people now. In fact, you could have a baby with 1 person.
It's not like twins.
Yeah,
Well, like with one parent.
1 parent, yeah. It'd probably be a girl, wouldn't it? Because you'd need a wife for the bloke, right? So you could, yes. So so for example, you need 2 X's to produce a female. So you've got 2 X's, haven't you? Yeah. Well, you have, haven't you? Yeah. But you haven't got a Y, so you could only have a girl.
Yeah.
Yeah. Whereas I've got an X and a Y, so in theory I could have a girl and a boy. Yeah.
But then would the baby have all the same genetics as you, so it would be like a clone?
Be a clone, yeah. Yeah. Now, I think the interesting thing about the genetics is not creating designer babies, is actually finding out that you've got a gene that might be predisposed you to a nasty disease or a cancer or even type 2 diabetes or whatever, and actually removing that gene or substituting that gene with somebody else's gene. So for example, if you're carrying that gene for Huntington's disease or whatever, which is fatal, is in the future, I think you'll be able to remove that gene and put another one in its place. And what they do now is they can actually, with cystic fibrosis, obviously they've got certain genes missing which causes their issues, is they can actually use viruses to actually put in a normal gene into that DNA. So yeah, I'm thinking about, yeah.
Where does that line stop though? Because if you say it's bad genetics to be short,
Yeah, could I have a quiz?
Well, yeah, I agree with you. And it gets even worse than that, because if you actually map prison populations, you find a lot of people in prison actually carry certain genes. Okay? Right. So do you, when you're a child, you decide that you're going to do something with that child because they're carrying that gene?
And is that a guarantee that they're going to be bad?
Exactly, yeah.
But is it, and people use that in court cases, I have a gene that's going to do that?
Well, I kind of, that's the kind of thing you could, well, my fault, it's my parents. They,
That's just too far.
what is,
So it's going to 10 murders, but it's not my fault.
yeah, but then you guys here, you're the future. It's up to you to decide where the moral lines are drawn.
You can't draw moral lines depending
Yeah, but we've got a moral code in, haven't we? It's kind of sort of moral code, and we've decided where the red lines are, haven't we? I know there's sometimes those red lines are being pushed further and further. Yeah.
But you might think that one thing's right and I might completely.
Yeah, but it's more of a consensus in a way, isn't it, really, I suppose, decide what we want. But what I'm saying is, really, genetics is really going to take off. It's going to be a massive kind of discipline. The thing about genetics is that genetics is always taught in the first year, first term, first year. So you've left home, you know, enjoying yourself, great, then you start your lectures and everybody hates genetics because it is boring, really, because it's just about 4 bases and whatever. It's very, very boring. But really have a think about genetics. All BMS degrees now have a big genetics component into it. And the other thing that is taking off is genetic counselling. So people will be presented with the information about their genome, and then somebody will need to talk them through it. They will need to decide if they need to terminate a child, or if they didn't want to. I think in the future what will happen is, and it happens in certain populations, is that 2 people who decide they want to have a baby, they will look at both their genetic patterns to make sure that there's no 2 dominant genes, or recessive genes should I say, in either of those patterns to come together to form a dominant gene and cause an issue for the child. And nobody wants to go into genetics. There's loads of jobs in genetics. And because there's nobody wants to go into genetics, after the first degree, all postgrad courses in genetics are free at the moment. So all MScs, PhDs, they're all free. So career-wise, we've got a number of people, support staff have no specific qualifications. Associate practitioners, they generally come in and work with A-levels. They kind of similar to biomedical sciences, but they're not they don't have the scientific knowledge, so they don't release patient results and they don't validate patients' results. The BMSs, which are the majority of the workforce, clinical scientists who sit between BMSs and medical staff. We'll talk about clinical scientists in a mo. Right, so the majority of staff within laboratories are BMSs, 22,000. They require an accredited degree by the IBMS. If you're going to do BMS and you want to go and work in a clinical laboratory, make sure that your degree is accredited by the IBMS, which is the Institute of Biomedical Sciences, because they basically control the whole of the workforce. You get your degree for 3 years, and then you need to find a training laboratory, and you need to be registered by the Healthcare Professional Council. And there are lots and lots of career opportunities, specialist roles, management, education, quality, and genetics. So talking more about the degree, there's 2 types of degree you can actually do. You can do a 3-year course, for example, i.e. in Hull, or you can do a 3-year course with a built-in placement. If you do a course like, for example, at Hull, then you need to find a laboratory that trains you to become a BMS. So you need to have a placement.
Do they support you with that then, Chris? You know, will the university support you with finding your placement sort of thing? Yeah.
This one here, the 3-year course with a built-in placement, will help you, right? And what we have done, because obviously we have a bit of a recruitment problem here in Hull, is that we've scoured the country, and anybody that's been doing a BMS degree in any kind of near university but live in Hull, is we offer them a placement. So we've got people from Sheffield, from Newcastle, and people from Nottingham Trent, because weirdly enough, people who live in Hull generally come back and work. We had a massive problem over the last couple of years because we've been training people have been coming into training positions. Obviously we interview them, they come, they work for us, we train them, and then bye-bye, I'm going back to Manchester, big cities or London, whatever. So we're really kind of targeting our local population. Yeah, and again, make sure your degree is accredited. A lot of this is probably a bit confusing at the moment for you. There's some literature there, but if you ever get confused about types of degrees, what degrees you can use, etc., then my email's at the end, and Vicky's got my email. Clinical scientists, okay, they have any degree, okay, any science degree, a good science degree, first or a second. And what happens then is that they can go into any of these roles. So you get a first degree, and then you enter what we call the Scientific Training Programme, which is a 3-year course leading to an MSc. This is fully funded by the NHS. So you get a salary and all your education is funded. So that's another route you could think of getting into. And these clinical scientists now are working almost to the same standards as the doctors, as the medics. And after you've done an STP, you move on to higher specialist, and they pay for a professional doctorate for you. So this is another route to think about. And finally, just a few facts about pathology in Hull. We do 2 million samples a year, which is kind of strange because the population of Hull and East Yorkshire is 500,000 anyway. So that's kind of that's 4 each, isn't it? We're one of the largest clinical laboratories in the UK. We have state-of-the-art technology and IT. We have 300 staff. We have a great record of quality and training. And there we are. In front, you've probably seen that from the railway line at some point. There you go. Right. So this is a useful thing to look at, healthcarecareers.nhs.uk. That will lead you to all 55 or 51, 55, depends on how you categorize them, careers. If you're thinking about a career in BMS, then the ibms.org is another good site to have a look at. And it's really easy to remember, Chris Chase, isn't it? You can go through Vicky, or I have no problem about anybody emailing me directly and saying, just what do you think is this degree, or what should I do, etc., etc.